Well, according to the CDC, almost 1/3 of healthcare workers in the country are still not vaccinated against COVID-19. And officials worry that a shortage of critical workers will ensue as a nationwide mandate goes into effect next year. For more on this now, we're joined live on the KCBS Ring Central Newsline by Paul Siegert, managing partner at PCS Advisers, a health benefits consulting firm. Thanks for joining us this morning, Paul.
Thanks for having me. Happy Thanksgiving.
You as well. So why has there been resistance to vaccination, particularly among healthcare workers?
Well, I think many of them cite the fact that they have natural immunity. They were exposed to COVID in many cases, had COVID. Some health systems prior to the OSHA mandate was announced were actually allowing that as an exemption. And there is some precedent in that field to allow antibody tests to qualify as an exemption in lieu of vaccination for other required vaccines. So for some of them, that is their argument against it. And there's a kind of a big untold story as well in the fact that not only do we have a small percentage that will choose not to get vaccinated when we see these mandates go into effect. Health systems report kind of what percentage they ended up having to let go, and it's usually not that high, maybe 1% in a large urban area, 5 or 6% in a rural area. But the part of this bigger picture of the story too is that we're watching 500,000 seasoned RNs retire, and they don't get counted in that number, but they're choosing to retire from burnout related to the pandemic as well as vaccination requirements, and it's going to lead to, or it's exacerbating an already existing shortage.
Yeah, I know that is the case. Now, Paul, a number of states are contesting current mandates. So what kind of recourse do workers have if they don't want to get the shot?
Well, there's pretty solid ground for an employer to make a mandate. There are many lawsuits going on right now around this, but they've, for the most part, they've been upheld, these mandates, if the employer is putting it in. And we don't expect that to change significantly. There will be some arguing around and possibly some success around gaining religious exemptions in states that aren't currently allowing that, or employers that aren't currently recognizing that. I think some 40 states do allow for religious exemptions and others don't, and maybe recently changed it in relation to COVID. So we're seeing some success there where employees are able to get a religious exemption, especially if those employers are allowing other kinds of exemptions, medical exemptions as an example, and making accommodations for that. But they really don't have a lot of options other than seeking employment elsewhere.
So, Paul, how dire could this get for the healthcare worker world when we talk about a worker shortage? I mean, you had mentioned, burnout on top of, all the mandate stuff. And I personally know one RN who has told me that she's quitting, and one of my best friends, an ER doctor, who has pulled back and gone to per diem and, gave up a full-time job because of burnout, So, I mean, how dire can this get?
It's a real dire situation. We're looking at having a shortage. We're going to need 1.1 million new RNs as of next year. And we churn out of our education system 180,000, 190,000 a year. Half of them quit by year 2 because of burnout. And that was before COVID, but that was the reality. So it's a tough situation. It's even tougher if you're in a rural setting. There are facilities, rural hospitals, maybe those 25-bed type hospitals. They are much harder hit. They can't afford to lose a couple of nurses without impacting their ability to provide care. And they are losing some over the mandate. They're also losing them to bigger urban settings where they're going for higher wages. You can be a traveling nurse today, get a $20,000 signing bonus and $3,500 a week. 2 years ago, it was $1,900 a week. So it's having an outsized impact on those more rural settings, but it's an impact across the country.
That's incredible. Like you mentioned, the traveling nurses. I do know another girlfriend who is doing the traveling nurses thing and says that she's making $20,000 a month. as a traveling nurse.
Possible. Yep.
Amazing. Paul, thanks so much for joining us this morning. Happy Thanksgiving, too.
Thank you.
All righty. Take care. KCBS News Time, 7:36. We're